Hi, this is Dr. Sushant from Apollo Home Care. Yeah, today is World's Diabetes Day. Let's talk on what is diabetes and what's its relevance to us. See, diabetes is a fast-growing lifestyle disorder. It affects almost every third Indian. So, what is diabetes? Diabetes, we know diabetes since ages, since centuries. In our literature and abroad, diabetes literally means passing through, like passing through urine. This is the literal meaning of diabetes. In Hindi, it is called madhumeh. That means sweet urine. Madhu is sweet, meh is urine. So this has been since ages. Definition: it's a metabolic disorder where our sugars are more than normal. So it's basically high blood sugar. Okay. Coming to threshold, what are the levels which you say that you have diabetes or not? Diabetes is a biochemical disease. That means in early stages of disease, you will only know it only if you are testing your sugar levels. You will not have any symptoms until you are late in the disease. So what are those levels? So we say fasting sugar and post-lunch sugar will help. These are the tests required to check for fasting sugar. Is overnight fasting. You do not eat for 8 hours, and in the early morning you get a sample done. That is fasting sugar. What is post-lunch? Post-lunch is after 2 hours of lunch or any meal, sample is given and sugars are tested. This is post-lunch. If you are taking any tablets, you have to take your tablets as per your time, and test is done 2 hours after meal. You should not skip your tablets on the day of testing. And what are the relevant test thresholds? Fasting sugar below 100 is normal. Between 100 to 126 is pre-diabetes. That means you are prone to diabetes in the future. And above 126 fasting levels is diabetes. Post-lunch is below 126. 126 to 199 is pre-diabetes, and 200 and above is diabetes. As far as HbA1c is concerned, that is a 3 months average sugar. 5.6 to 6.4 is pre-diabetes, and 6.5 and above is diabetes. So these are the levels. What are the symptoms to watch out for? Suppose a person has never tested in his 30s, 40s, and he suddenly starts developing repeated fevers, repeated infections, or he has to get up in the night to go for urination. These are the early symptoms. Or in 50s, gradual dimming of vision, recurrent oral issues. These are the symptoms to watch out for. Increased thirst, unexplained loss of weight. These are the symptoms to watch out for. Once into the diabetes, then the symptoms vary according to the organ affected. So these are the symptoms that we are looking at now. So now a person has diabetes. He was started on tablets, and how frequently he should monitor. So when you initially get diagnosed as diabetes and your doctor has advised for some tablets and lifestyle modification, you test your sugars after 15 days to 1 month time. What will you test? You will go for fasting sugar and 2 hours post meal sugar. Depending on that levels, your doctor may increase the dose of the tablet or decrease the dose depending on your sugar levels. It may take somewhere between 1 to 3 months time to get your sugar in range with that particular dose of tablets. So there are various kind of tablets available. All group of tablets have their own good effects, side effects. Some are going to make insulin work better. Some are going to make your body increase insulin. Some tablets will act as an insulin or will give insulin. So once sugars are controlled, how frequently you should monitor? once a person lands up in normal sugar range, normal that is fasting below 100, 110 and post lunch below 140, then they should get your sugar checked every 3 to 6 months to monitor. If the sugar increases, then dose has to be increased. If the sugar decreases, the dose has to be adjusted. But throughout this thing, diet and lifestyle has to be maintained. Pre-diabetes, it is decided by that sugar testing. What should you do? At pre-diabetes is completely curable. It can be reversed. Once a person lands in diabetes state, it is usually not curable. So in pre-diabetes state, body has enough capacity to revert back to normal, provided we do certain things. What are the things? We follow a healthy lifestyle. We go for a walk half an hour every day. Cut down high glycemic foods like white sugar, white rice, corn, ice cream, chocolates, sweets. These are the high glycemic sugars that will increase sugar fast, so fast that the body is unable to produce that much amount of insulin in a short span of time. So these are to be avoided. So to concise, pre-diabetes is curable and it is managed through healthy lifestyle and a healthy diet. You should include fiber in your diets. You should include fresh fruits, green leafy vegetables, etc. And once you are into diabetes state, management is by sugar tablets, insulin, and most importantly, diet and lifestyle. Diet and lifestyle management is the most important thing. Losing weight, cutting down oily, sugary foods will reverse your pre-diabetes state to diabetes, and sometimes in drastic weight losses, even diabetes can be reversed. Very few examples are there, but sugars can be controlled with this. High diabetes is it's a very arbitrary term. You can say HbA1c about 10, low diabetes around 7, 7.5, 8. There are no guidelines in such for that. As far as sugar intake is concerned, once pre-diabetes or diabetes, you have to cut down, you have to minimize your sugar intake. Stop it. Stopping would be the best thing. So what about insulin? In people, type 2 diabetes people in whom sugars are not getting controlled with tablets, they are shifted to insulin. So usually a maximum combination of 3 different sugar tablets is given. 3 different formulas is given at max dose. If they are not failed to correct, then person is shifted to insulin along with tablets. Is insulin harmful? No. Insulin is basically a hormone produced in the body. It's a natural hormone. We are giving it from outside. Of course, it is directly produced in blood. There will be no side effects. Its body recognizes it as its own. But since we are giving injections, there will be some complication, minor complication, because needles are good these days. There can be some pain initially. Insulin may not be stored properly, and sometimes insulin causes weight gain. Excess insulin causes weight gain. Okay, now coming to care plan for a diabetes patient. So first and foremost thing would be diet and lifestyle modification. Calories has to be cut down. You have to lose weight. Sugars, white sugar, maida, corn, all sugary foods have to be stopped. Sweets, ice creams. As far as exercises is concerned, initially walking and then brisk walking when you are acclimatized. 30 minutes at least a day is a recommended walking time. If you can do more, that's well and good, but minimum expected time is 30 minutes per day of walking. Another query that I'm getting is post-lunch test. It is during office hours or it is during odd hours. I can't do that. So such scenarios you can plan it on Sunday, or you can ask someone to come at home and do the test for you at that time, or you can get a simple home machine where you can do it after, you can self test it after 2 hours. In this way you can manage your testings this thing. Why do doctors write so many tests for diabetes? Okay, fine, I will explain it to you. Okay, so when you are newly diagnosed with diabetes, we don't know since how many years back you are having high sugars. Is it the fresh? This is the first time you are testing, but we don't know when it started and what is the reason for that, and did it cause any organ damage as such. So this is why that there are few tests that are required. So sugars, you have to do it 3 months average sugar HbA1c to know what is your current level before you initiate treatment. Then you go for cholesterol test, because diabetes and cholesterol usually go hand in hand. You check for thyroid, because thyroid related disorders, because thyroid and diabetes sometimes can be affected in autoimmune disease. You look for kidney function, because kidneys are affected in diabetes in the late stage. You look for liver function as a part of routine. You look for CBP to check other associated disorders, any infections. You look for ESR again to rule out any autoimmune diseases. You check for pancreas to rule out pancreatic diabetes. So these are, you do a urine test to see whether you are losing approximately how much sugar you are using in the urine, whether there is a protein loss in the urine. Are you having a subtle urine infection? So these are some tests required. And if a person has never done a test in the past, usually these tests has to be done as a part of routine to define a proper care plan, because the tablets that we are going to start will also have an impact on those parameters. Some may have some side effects. It really depends on the patient profile. So this is why some tests are done. Can this test be done at home is another query. Yes, these tests can be done at home. You have to be in fasting state. All are blood tests and urine tests that can be done and collected at home. There are many people available. You can go through them online.